Hello, everyone. I'm Mary Claire Spalding, and I'm going to present my neuro case study today. Today, we are going to be talking about Edith. Edith is a 67-year-old female who was previously independent and active in her roles as a wife, mother, and grandmother. Following a recent illness, she experienced sudden weakness that progressed to total body paralysis, requiring ICU admission and ventilator support. Although her motor function is severely impaired, her cognition remains intact. So she was diagnosed with Guillain-Barré syndrome, and with Guillain-Barré syndrome, we typically see ascending weakness beginning in the lower extremities and progressing proximally. Some common symptoms are muscle weakness, sensory changes, pain, and in severe cases, respiratory failure requiring a ventilator. So for expected occupational performance deficits, we are going to see that Edith is dependent in all ADLs, including feeding, grooming, dressing, toileting, and mobility. That's what we expect to see. Her motor performance skills at this time are going to be severely impaired. Her process skills are functionally limited due to her inability to physically perform the tasks, despite her cognition being intact. Communication is going to be initially limited due to being on a ventilator, but that will improve as her condition stabilizes and she is no longer dependent on that. She will be able to communicate normally, and in the scenario given, she is standardized assessment. I selected the Bartel Index. This assessment evaluates occupational performance in activities of daily living and is appropriate for Edith during this acute phase of her Guillain-Barré syndrome, where she demonstrates significant dependence. Although Edith is expected to score in the dependent range, the Barthel Index remains clinically appropriate because it establishes an objective baseline for functional performance that can then be used to monitor progress throughout her recovery. It's also good for an ICU setting as it relies on the observation of performance and it doesn't require extensive equipment or prolonged time to perform. So as I stated, the BI is appropriate for Edith because it provides a structured measure of occupational performance for ADLs. So even in these cases of total dependence, it assesses all of the key areas we want to see, especially in that ICU or the acute phase of feeding, grooming, dressing, toileting, and mobility. And all of these are going to be significantly impacted in this case. This assessment primarily addresses performance skills, particularly the motor skills, which are severely impaired due to her neuromuscular Guillain-Barré. It also reflects client factors such as strength, endurance, and neuromusculoskeletal function that directly influence her ability to perform these daily tasks. So we are going to capture a little bit of performance patterns by highlighting how her daily routine and roles are affected at this time. Even though her current level of function is limiting, establishing this baseline is crucial for tracking improvement and guiding interventions and plannings, level of assistance, and discharge decisions. So there are some other assessments that would be appropriate at this time. We could do the Canadian Occupational Performance Measure. However, right below this in the case study given to me, it's performed by the next OT, and that is because it can capture performance and satisfaction in meaningful activities as along her recovery stage. Hi, Edith. My name is Claire, and I'm going to be your occupational therapy student for the day. How are you doing today? Yeah, that's got to be really hard right now. Edith, I'm just wondering, so today I was hoping to do just a brief assessment with you to understand how you're doing your everyday activities like eating, grooming, dressing, This will just help to determine the level of support you need right now and help to guide my therapy going forward. I'm just going to ask you to try a few simple tasks. I just want you to do as much as you can. And if anything feels uncomfortable, just let me know and we can stop, okay? Okay. All right. Okay, Edith. I'm just looking to see right now if you are able to, I'm going to assess grooming. So can you show me if you're able to bring your hands up to your face? So as if you were going to wash your face or brush your teeth. Can I see you try that? Okay, that was a good try. Edith, have you been having any difficulties with bladder control right now?
I have a catheter in.
Okay. All right. And then for bowel, have you been, for going to the bathroom, have you been needing some assistance with that as well?
Yes.
Okay. And then, Edith, I talked with nursing, and right now they say that you need full assistance with dressing, and that you're not able to kind of assist with that at this time. Would you say that that's accurate?
Yes.
Okay. All right. Thank you, Edith. Overall, right now, this client is demonstrating dependence across all ADLs, indicating significant limited occupational performance in self-care. Here is the Barthel Index scoring sheet. Edith would be scoring a 0 in all categories as she is currently unable to perform any of the activities, giving her a total score of 0 to compare for as she continues to come out of the acute phase into the subacute phase. For this non-standardized assessment, I focused on Edith's ability to engage in meaningful leisure activities using voice-activated technology. This assessment was based on Edith's occupational profile, where she specifically mentioned her routine of reading the Bible each morning and how important it was to her, as well as family. Although this task is not cognitively demanding, it is appropriate because Edith's cognition is intact, allowing the assessment to focus on functional engagement and participation rather than task difficulty. This assessment complements the Barthel Index by capturing aspects of her occupational performance that are not reflected in basic ADL measures. So for my rationale, we're able to hit area of occupation, performance skills, client factors, and performance patterns. So this non-standardized assessment evaluates the occupational performance through participation in meaningful leisure activities. It specifically addresses the area of occupation leisure, which is significant to Edith's identity and her daily routine. This assessment evaluates performance skills, including process skills, initiation and sequencing, as well as communication and interaction skills through the use of verbal commands. It also considers client factors such as endurance and coordination and overall physical effort for speech during the task completion. Additionally, this assessment captures performance patterns by examining Edith's ability to re-engage in her established morning routines. Although Edith is expected to perform well due to intact cognition, this assessment was selected to evaluate her ability to translate that cognitive ability into functional participation, where she is using adaptive strategies. This is important to her because it reflects her transition from dependence in that acute phase to some increased engagement in meaningful occupation. In the next video, you're going to see Edith use her phone and use Google Assist to open her Bible app and play where she is currently paused on her Bible in order to support that routine of her reading the Bible every morning. We are also going to see her use Google Assist to call her mom on her phone. she is able to perform these independently to support the areas of occupation of leisure and her performance pattern and routine that she previously engaged in. Edith, could you please use a verbal command to open your Bible app and begin the audio playback?
Hey Google, open Bible app.
Good.
Play.
Wonderful. Great job. Now, can I have you call a family member for me?
Hey Google, call Mom.
Wonderful.